Continuation video on HIV. So for infant, in regards to the infant, there are two things that we have to talk about. The first one is the testing or the monitoring. Second one is the prophylaxis. So prophylaxis and also the monitoring. So let's talk about the prophylaxis first. So we can divide an infant into three groups. So whether the infant will become high risk, low risk, or very low risk. So the infant will categorize into a very low risk, very low risk, if the mother on CART, this determination to use in RCOG, but in Malaysia we use heart. If the CART use more than 10 weeks, and also two maternal viral load less than 50 copies per mil within 4 weeks intervals. So for example, at 32 weeks, the mother had copies less than 50, and at 36 weeks repeated again less than 50, and the mother on heart for more than 10 weeks, then the patient will become the infant will become a very low risk. If low risk group, one maternal viral load less than 50 copies per mil, and also less than 50 copies per mils at 36 weeks, or if born prematurely, still the less than 50 copies, then it is also considered as a low risk. So viral load less than 50 copies per mil if prematurely born, because if the mother delivered, for example, at 34 weeks and she had one viral load taken at 32 weeks, so it's still considered a low risk. And high risk is other than above features. So what do we give in a patient with low risk for the infant? This is only about infant. So for the infant, if it's a low risk, then very low risk only requiring zidovudine therapy for 2 weeks. But if in the low risk, very low risk, 2 weeks, low risk, 4 weeks, and if high, we have to combine. Okay, so when do we test the infant? So the infant testing can be divided into two groups. Either, since we know that the risk of transmission after delivery, so during intrapartum, these the features. After delivery, the monitoring will be depend on whether the infant on formula or breastfeeding, because breastfeeding contribute to 15% of transmission, while formula of course have a lesser risk, given that if the mother don't have any card or something that can actually transmit the things. And the HIV and saliva or tears is actually very low, and we can actually neglect the way of infection through the saliva and also tears. So when should we take infant testing? So this is formula fed child, and this is breastfeeding. Because in a country like Malaysia, when the government is giving the milk, the formula milk for all HIV patients, so it is a must to ask patients to give a formula feeding. But in a country where they cannot afford to to actually do AFAS, which is the breastfeeding BFSI's criteria for formula feeding. If they cannot avoid AFAS, then they have to breastfeed the child, fully breastfeed the child. So both have to be tested within 48 hours and also upon discharge. And 48 hours upon discharge. And for formula fed child, they need to repeat at 2 weeks time, and then 6 weeks and also 12 weeks. 6 weeks, 12 weeks. And another level will be taken at 1 year and a half or 18 months, and 2 years old, 24 months. That is for the child on formula fed. So basically, as you can see here, if it's a very low risk infant, they will be on zidovudine for 2 weeks here. If it's a low risk infant, the zidovudine will be up to 4 weeks here. So in other words, the infants on formula fed need to be taken the tests, the CD4 count, and also the antibody, antigen and antibody at 6 weeks or 2 weeks after the treatment, and also 8 weeks after the treatment. This is also in the MCQs, so don't get confused. While the infant with on breastfeeding, so we advocate the same 48 hours and upon discharge 2 weeks, and then each month. So 2 weeks is half month, so 1 month, 2 month, 3 month, 4th month, 5th month, and 6th month, because breastfeeding usually up to 6 months until the baby starts to wean down. So 2nd month, 3rd month, 4th month, 5th month, 6th month. And then after the accusations of the breastfeeding, 4 weeks after that or 1 month after that, and also 8 weeks after the accusations of the breastfeeding. And the same 1.5 month, 18 month, and 24 month. So this is also included in the MCQs. I hope it helps.